At the first visit they did the single arch scaling, and at the second visit they completed the scaling and prescription was provided. In these are the clinical pictures. This is the before scaling one and this is the after scaling. You can sense the reduction in the size of hyperplasia after scaling, and it is because of reduction in the inflammation and as well as in the reduction in the bacterial count after the scaling and polishing. Moving on to the third follow-up, gingivectomy was performed, periodontal pack was placed, and the specimen was sent to the laboratory. This is the clinical picture before gingivectomy, and this is the clinical picture after the gingivectomy, and this is the clinical pack placed. This was the periodontal dressing placed for periodontal pack. It is a non-eugenol based periodontal dressing, and it comes in two paste. In one there's a base, and in second one there's a catalyst. It has antibacterial property as well as antifungal properties as well. Also, one more thing is periodontal pack provides protection to the soft tissues, but they do not provide healing factors to the soft tissues. So they contribute in healing in a way that they protect the soft tissues, but they do not provide healing factors. Moving on, this is the clinical picture after placing the periodontal pack. The last follow-up that was 1 week after the periodontal pack was placed, and what we did in this, we removed the periodontal pack, and you can see the well developed scallop and as well as soft tissues were healed. Now, this was the biopsy report of a patient, and the conclusion was that the gingival hyperplasia was due to chronic moderate non-specific inflammation. There was no signs of malignancy, and it was a benign lesion, as well as there were some infiltration of plasma cells and lymphocytes that are inflammatory cells. Now, this is one of the articles which I have extracted, and in this article, in this study, they assess the comparative efficacy and safety of medical interventions in management of OSF. So what they did, they had 2063 patients, and this article was published on 1st August 2022 in the Journal of Personalized Medicine. They had 2063 patients on which they applied different strategies of medical interventions and compared the efficacy and safety of it. And they divided the therapeutic effects into two. Number one is mouth opening, and in mouth opening, Oxytard and lycopene showed the best results in improving the mouth opening. Basically, Oxytard is an herbal medication in which gooseberry palm is included, and as well as amylaka. Other than that, lycopene is a carotenoid hydrocarbon. Carotenoid hydrocarbons are found in red vegetables as well as in red fruits, like vegetables like tomatoes and fruits like watermelon. Other than that, hydrocarbons are those compounds which have hydrogen and carbon in it. Moving on to the improvement in burning sensation, aloe vera was found to be the most effective and most significant in reducing the burning sensation. Now, the advantage is that aloe vera is very readily available as well as cost effective, and we can introduce it in our management as well now. Moving on to the conclusion, and conclusion was similar, that the aloe vera was the most effective agent in reducing the burning sensation, and lycopene and Oxytard was the best in improving the mouth opening.